Welcome to the introduction to the online hereditary cancer quiz. This introduction will define the tool, explain why it should be used, how it should be used, explain frequently asked questions, and the procedure for requesting customization. As account executives, you are faced with an increasing number of issues to consider when implementing a protocol integration workflow. Knowing what cancer family history questionnaire tools are available allows you to improve customer relations and impact patient identification. Cancer family history impacts medical recommendations and treatment plans. Failure to actively use cancer family history can lead to clinical blind spots, including a misdiagnosis of cancer risk and over or under management of patients. Thus, the use of cancer family history is extremely important for the proper identification and management of at-risk patients. Despite being aware of its importance, a recent study in oncology indicated that only 29% of doctors' medical charts include a complete cancer family history. Taking a complete cancer family history involves collecting the cancer history of first and second-degree relatives, including their age of cancer diagnosis. Family and personal history are the hallmark factors in identifying patients at risk for hereditary cancer. However, this study found that 71% of oncology medical charts are missing important family history information. When we look at an OBGYN, on average, about 15% of patients were appropriate for testing, and 24 to 37% of patients seeing a medical oncologist were appropriate. How many of your providers are testing the number of patients they should? It's clear that a large percent of patients are not receiving appropriate medical management because providers are not actively collecting and using cancer family history. There are doctors like this in your territory, and this is how the online hereditary cancer quiz can help. There are currently almost 100 high users of the online hereditary cancer quiz. On average, these providers implemented 7 more incremental tests in one quarter than their previous quarters. That's an additional $24,500 in revenue per provider. Clearly, the online hereditary cancer quiz can drive growth in your customer's practice. The online quiz also enhances your relationship with healthcare providers by delivering a free and innovative tool that has an enormous positive impact on their ability to accurately identify patients at risk for hereditary cancer. And this is something the competition cannot provide. Let's explore this further with the help of some examples. This OBGYN is a leading physician in her field. She captured new patients who completed the quiz and then scheduled appointments just to find out their results. Following their visits, many patients stayed and made this doctor their women's health physician due to the high-quality care they receive. This OBGYN and her new patients weren't the only ones to benefit. She also directed her current patients to the quiz 2 weeks prior to their annual visits. Her first 90 days using our quiz resulted in 47 incremental tests totaling more than $160,000. Let us look at another example. This doctor is a leading breast surgeon who is part of the Comprehensive Breast Center. She and her center began using the hereditary cancer quiz to identify patients at risk for hereditary cancer in December of 2013. They began by emailing the quiz to the entire patient base and adding the quiz to their website. They had great success and now email the quiz out to their patients every quarter. Following the implementation of the quiz, this doctor had a 237% increase in testing volume in 2014. That totals more than $639,000 in incremental revenue. But this quiz is not just about increasing revenue. It is also an opportunity for you and your clients to make a difference in your community. For example, 3 women in one family in Middletown were helped because one of the sisters took her quiz results to her healthcare provider. After finding out she was positive, her 2 sisters were tested and found to be positive as well. Click Next to check your understanding of this chapter.